Dear viewers, a very warm welcome to our today's format visit. Thank you for your time, thank you for your attention, to want to learn, to want to understand, and that I can inspire you for something. I think that is the most important aspect that we doctors should have. That we convey desire for health, because without each individual it is not possible. And if I don't understand myself, if I don't enjoy changing something, doing something with me, getting out of my comfort zone to do things even better for me, then it is difficult to find a way back to where I believed or where I would like to go. I thank you for your entries on Visite at QS24.TV. This of course always offers me a very nice basis, and I would like to pass it on to Ilona. Ilona, you are 57 years old and you write that you observe that you develop a beginning bladder weakness. And a bladder weakness, Ilona, you write in brackets a so-called stress bladder or a stress incontinence, that is also called. That means it may not even come to bear in everyday life, but then when it comes to the fact that the bladder muscle is strong, then it becomes a nuisance for you, like for example when jumping a trampoline, or when the bladder has to hold a lot of urine. These are things that make you a little uneasy. And I would like to answer that. I would also like to give you a little tip on this. I don't know where your love goes, where you also spend your free time, but a belly dance course is incredibly valuable, because as a woman you notice that you have a pelvic floor at all. And everything that strengthens this pelvic floor is of incredible importance. And you can take that back. So that's not something you have to live with. Of course it's good if you've been aware of this for 10 or 20 years, that this structure and the tension of the muscle, which is a cross-striped muscle, and the smooth muscle on the bladder itself, if these things can be strengthened over the years. But life doesn't just invest in strength if it's not needed. And we must not forget that we can develop weaknesses in the area of pelvic floor. But I'll get to that in a moment. But a belly dance course is something really great. And there are really women like you and me. And that's an incredibly valuable experience. Another thing is, if you want to tone the bladder muscle well, that you might do a bladder muscle training. There's nothing wrong with that. It's just in a rhythm with a certain in and out. Training the bladder muscle. And I have a thing that I do that whenever the traffic light is red. Whenever the traffic light is red. And when the traffic light is red 5 times a day, I'm looking forward to it. I drive extra slowly to the traffic light because I want it to be red, because I do it with me. But I've been doing that for 30 years. So you train these things every day. And then there's a rhythm to it. And then you notice something's happening. But at the end of the show, I would recommend something else that you could do yourself. But now I want to go back to how something like this is created. And it doesn't just come about that way. The muscle itself, the bladder muscle, is dependent on its naval supply. And it's also dependent on its mitochondrial energy output. So a muscle is always strong or gets strong when it's needed, of course. That's why training is really essential in the future. The other thing is that the front teeth are attached to the energy supply of the bladder muscle. That means, if you've had a front tooth in the last few years as a root-treated tooth, these are the 4 front teeth at the top and the 4 front teeth at the bottom that correlate with the bladder-thin stomach meridian. These are teeth that are directly related and must be identified as a disorder. A very holistic dentist can clarify this very well and find a solution here. Neural therapeutic injections to the front teeth can also treat such a disorder in the first instance, in some cases very well. The other thing is that a so-called conceptual vessel goes directly over our body. It's an energy conduit that can be blocked, of course, for example by a disorder of the navel scar. We don't always think of the navel, but these are disorders that result from this meridian blockade. Or a large scar, exactly parallel to the sexio, or a subcutaneous operation. These are things that are cut off in the media, or a conical scar. I once observed someone who had a lip band. As a child, it was cut off. And it was this nerve that caused functional disorders again and again. These are important things, also in terms of reflection on the back, when a lip band surgery has been performed, when scars have developed. Really look at these things. They can have a muscular fatigue as a result at that moment. And then it is very important, when you go through this process, to take the system with you muscularly, to train again, to exclude these disorders. The other thing is, of course, that these are operations that may have been performed by a certain binding tissue weakness or a defect in the subcutaneous tissue, which is also affected by the operation scars. The other thing is, of course, that these are things that affect mitochondrial energy production of each muscle cell. And here I simply ask that you let your Q10 be measured, that you also have the carnitine metabolism examined in a laboratory chemical way, and that you know different things about it, so that you also know what I can do here in a very specific, orthomolecular medical way. And this Q10, the Consignment Q10, has a major central role in the framework of our energy metabolism, in the conversion of fat and carbohydrates into cell energy. We are talking about 38 millimoles ATP per unit, and this is a situation that is essential so that a strong muscle can rebuild tomorrow. This Consignment Q10 is not only a pacemaker function for the energy metabolism of the urethral musculature, but also has time or also for reaching tasks that a cell also has a stable cell wall integrity within the framework of its potassium-nitrogen pump and within the framework of its entire cell function. This means that the fluidity that a membrane must provide, for example, so that potassium and sodium interact with each other, is very important. This is why this passenger transfer is guaranteed by Consignment Q10. On the other hand, it is crucial for the immune competence, because we are talking about phagocytosis of the macrophages, which is stimulated, i.e., in the framework of vibrational bacterial stress, the immune competence is increased by Consignment Q10 and also granulocytes, white blood cells, are produced on this stimulus more and more. Consignment Q10 is not just an all-rounder for the musculature here, but I use it in the most diverse sense, because a decreasing energy output is also responsible for a decreasing functional output. If you imagine that these mitochondria, which are small bacterial structures that have their own cell metabolism, are dependent on the power to produce energy, on what we guarantee them, on what they have to resort to, then this is a very important point for all cardiovascular diseases, because the heart is of course far more supplied with mitochondria than the normal cell. The normal cell has, for example, 100 or 1000 to 1500, the muscle cell, depending on how well they engage in sports. On the other hand, the heart has up to 3000 to 4000 such mitochondria and is thus also an organ that always, with a decreasing heart output, but also with blood pressure or with blood clotting disorders in the heart, is very well supplied with Q10 again and again, especially with low blood pressure, because this, of course, significantly stabilizes the heart function. But also all neurodegenerative diseases. You can measure the Q10 level, which is about 0.6 to 1.5. If you measure the Q10 level, then there are laboratory values from 0.78, so about. These are completely underrated therapeutic levels. So I expect a normal level consumption of over 2.5 from a patient with Parkinson's disease, with MS, with all these other diseases, far above 4 to 4.5. There are already other doses that are used therapeutically, then if I buy Q10 now for 30 mg, they can achieve very little and it has to be treated in a dose-adjusting way. But it is quite natural that I sometimes go up to 300, sometimes 400 mg. But of course also with diabetes, with all blood clotting disorders, this is such a high radical catcher for free radicals and thus also one of our most important ones with antioxidants. Do not underestimate the use of Consignment Q10 in the migraine. This has proven to be of great value in the prophylaxis, but also in migraine attacks, because it transfers the energy here highly in combination with magnesium, in combination with vitamin B6, but also the detoxification performance. The liver is essentially attacked and supported in neutralization of highly toxic free radicals in the cell walls by Consignment Q10. Anyone who does competitive sports simply has to know that he has a very high performance need here, that he wants to return to high energy production. And these are also valuable things that can be integrated. And especially in the context of your performance, if you have measured the Consignment Q10 level, but perhaps first a very high quality Consignment preparation or ubiquinone or ubiquinol, it's all the same, get it and then take one. And then you can adjust the dose accordingly. But I would really get on with 200 mg without any problems. The Consignment Q10 is in different foods. If you Google it, it's quite different. These are mushrooms, this is fish, for example. Trouts have a share, but also cheese or avocado. These are small amounts of structures in the body. But then it synthesizes of incredible importance. So I just want to say that this cellular energy change is so important now that you integrate it to your initial stress incontinence, as it is so beautifully called. That is, this phenomenon then only occurs under stress or strain. The other thing is that we don't just need Q10 for mitochondrial energy change. We also need valuable B vitamins. We need magnesium. We need L-carnitine. And L-carnitine is just as important for cellular energy change. It also stabilizes the cell membrane. It is important for mitochondrial stress or mitochondrial performance. It acts as an antioxidant. And it is of great importance because it, through a series of mitochondrial energy paths, through antiepileptics, through pantethol, through statins, i.e. fatty acid substitutes, through antibiotics, this mitochondrial energy path is also negatively influenced. And of course it is important that you also add L-carnitine here. Usually that is about 2 grams. But you can also start taking it in at 2 to 4 grams. We sometimes go up to 6 grams per day. But you just have to adjust the whole thing to the dosage. My experience is very, very positive in the context of a very young age. You are only 57 and not 75. And don't forget that life urges for stability. Life urges for being challenged. We are in an age where we look back at 57 or 63 years to have lived, served, given. But it is never too late to do good and to get some stability and strength back. I have very good experience with the Castaneda, this Castaneda method. For those who do not know it, I would like to say a few words about it. Castaneda also makes you aware of the movement. It is a form of reinforced tension. Life is not just about going to the pony farm. We also need to get a certain power and strength. We also need to get a certain basic tension. But it makes us aware of the movement. That we are maneuvering out of curvature through this method. In deforming. In degeneration. That we can avoid all these things. But we can also improve the structures around our tendons, fascia, muscles. That we give them a new tension structure and thus also give them a new life force. This lack of tension is actually this being straight at 60 and 70. This being straight, this being there. I am here, I did not get old and crooked somewhere. The body always does only what it has to adapt to. But these structures are maintained and thus also in an optimal alignment. An improvement of the structure where the femininity sits, that is our center, that is our root, creates a great alignment. By building up a great tension in us again. These are all the buffers. She calls them airbags, which ensure that the network of all these fascia and muscles, joints and ligaments, structure themselves better again. That is why it is so important to get into this dialogue with yourself. And then of course to lead the body back into a vertical, clear, upright, beautiful radiance and charismatic personality. Which actually has a strength that it builds up very strongly from the inside. Not only psychologically, but also purely physically. I think it's very nice that you write, "I am now 57 years old and I feel it." Then there were an incredible number of things in life that perhaps did not give the life the awareness, or did not give the time, or now perhaps things in life that you believe, they catch up with us. And this process can be really, really nicely brought back. But doing is the big word. And I hope that I have now been able to explain the problem a little bit with my few explanations. I am very happy and thank you very much, Ilona, for your letter. And actually want to read a text from Hans Kruppe again today. And this text is called But. Fail, but not bitter. Be deceived, but not deceive. Give up illusions, but not hope. Suffer disappointments, but not give up. Find yourself, but not stumble. Be deceived, but stay sincere. Lose dreams, but not stop dreaming. In this sense, I wish you all a wonderful time, a sunny and beautiful autumn. The flowers are so beautiful because they always point the life upwards, the gaze, and leave the less beautiful behind. We have no influence on what was behind us anyway, no longer. And we only have a limited influence on what tomorrow is, by consciously holding what is today in our hands. In this sense, I wish you all a wonderful week and I am very much looking forward to the next show visit with you. Thank you very much.